Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. We're in studio. It's raining outside, but not inside and not where you're listening to this. Love to talk to you on any subject you have in mind. We have a special topic, but you know what? Maybe you've had a problem, you've tried, you've applied. Let's see if we can do something about it. Put a little different light on the subject, if you will, without drugs, without surgery. This is where you find us, 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're here, we're waiting, and we have the answers, as we always do, saving you from the needless irritations and interventions of some medical procedures that I wouldn't recommend to my worst enemy. But having said that, in studio, my dear friend, the professor, the brilliant one, the guy that's going to talk to you about foot and ankle pain, Dr. Browning.
Good morning, Tom. It's always nice to see you on a Sunday outside of the office.
I know. At least we can get and chat a little bit. We see each other in the hallway and we wave and so forth, even though that your rooms are next to mine and I'm next to you, but we don't get a chance to talk.
No, actually we don't.
So this is the fun part. So, anyway, we're going to talk about a presentation that you're doing this Wednesday at the Roselle Center for Healing. We're going to be talking about foot and ankle pain. And, you know, the foot mechanism is very unique in that if it's not stable, if it's not working properly, nothing else in the body is going to operate at all similarly because it destabilizes everything from the ground up. But what people don't understand as well is that the foot can be compromised from above down. So let's talk about that a little bit. You know, there are a lot of common conditions that you see. People come in and they complain of pain, whether it's because the doc told them they have arthritis in their foot, or they have plantar fasciitis, or they have tendonitis, or a sprain, or bunions, you know, known as hammertoes, all those crazy things. But the bottom line is that people don't have to live with foot pain. There's a resolution. Let's talk about that. Let's talk about just the evaluation of the foot and why it's so important in its relationship, its mechanisms.
Well, since we stand and we walk a lot, obviously the foot's going to be impacted by our body weight and gravity. So if we lose good integrity of the foot, in other words, the arches of the foot maybe collapse or the position of the foot becomes different over time, then it's certainly going to affect the foot itself and the ankle, but more importantly, it's going to have a global effect on our knees and our pelvis and our back. So when I work up a patient, I know you do this too, we always look at the foot regardless of what their complaint is, because sometimes what seems like the problem is not necessarily the problem, and it might be something far away from it. For example, shoulder problems very often are adaptations to the way we carry ourselves, and if we carry ourselves differently because our feet are not stable, then we're going to have to look at that when we consider the diagnosis and certainly the treatment.
Well, I know one of the things that you do and I do as well is we'll have patients walk up and down the hallway outside the treatment room on our initial examination and absolutely subsequent to that just to see how their gait mechanism is firing. It's one of the initial examinations we do on everybody's. We do a foot scan where we have them walk across a pad to determine acceleration of the foot pedal base. But it's critical to understand the interrelationships, the mechanisms. There are acupuncture circuits that start on the foot and some that end on the foot. There are it's the old saying that the ankle is connected to the knee is connected to the hip, and so forth and so on, as the old song goes. So let's talk about specifics relative to maladaptation. Then we're going to get into talk about very specific conditions. And we'll talk about some of the onset of these problems. Particularly for those of us who've been walking around the malls the last week or two or three, we find that we're hurting, and we don't know why we're hurting. We've been on our feet, and all of a sudden we start aching. Not only the foot aches, but everything else above it. So what's critical about someone that comes in and says, Doc, my feet hurt, besides wearing these, 3, 4, 5-inch spikes that some of these women wear, which, we keep donating to the shoemakers' retirement funds because women are always going to have problems because of that. But more importantly, the mechanism is critical. What do you look for, Doc? Well,
I think you hit it right there. Unfortunately, we forego function for fashion, number one. So people will wear shoes that are not appropriate for the way their foot is. Either the toe box is too narrow, so it funnels all the toes in down, or the heel's too high, which is going to shorten up the muscle in the back of our leg called the gastrocnemius. The end product is the foot can't function the way it was designed. So we are changing the blueprint and kind of rolling the dice to see what happens. Some people are pretty resilient, and they can do that for a long time and never have problems, but a lot of folks aren't. And so what they'll see is they'll see their foot slowly break down, and that will be either through a tendinitis or maybe a degenerative change or an arthritis or something like that. So footwear is key.
The mechanism of contracture, if you will, due to a high heel, or even for some guys, and even forget the high heels. How about all this nonsense that we're seeing now? They drop the heel in some shoes, and then they do other things with it because it's the style. They say it's better, you can run better, and so forth. The problem is that people aren't running; they're walking. People aren't, in a sporting event. They're hanging around. They're standing. The mechanics are not the same. So you have to evaluate all footwear. And when a patient comes in and say, I'm hurting, my feet are throbbing, they're killing me, rub my feet, that whole mechanism has to be evaluated.
Yes, and it's interesting to note that most foot problems, believe it or not, have a lot to do with the way we are held inside the womb, meaning that the feet very often will rotate in, and that position of the feet will dictate the way the bones of the foot actually grow, and certainly the length of the ligaments. So coming out of the gate when we're born, we have a predisposition to have one type of foot design per se compared to another one. So if we do not do the things that we need to do hygienically for the feet, in other words, we don't wear the right shoes, or we don't take care of the musculature in the feet, or we don't strengthen or stretch, then it's kind of a one-way street, and then we start to see the development of the ankle problems, or the plantar fasciitis, as you refer to, or the heel spurs, and all those types of things.
Actually, to go to what you just talked about, many foot problems, particularly toe-in problems, pigeon-toed, or the feet that are going to the outside, duck foot walk. We know that those are related to many things, but as you just said, a lot of them are positional relative to birth. And unless you correct those over in the initial stages with a child, if you don't get to them quickly, the manifestation is a lifetime of all kinds of structural problems within the pelvis, structural problems within the spine, and things that just don't seem to go away, and most physicians say they're normal. Dr. Harlan Browning, my guest, your host this Wednesday evening, December the 12th, at the Roselle Center for Healing at 7:30 p.m. He's going to be talking about foot and ankle problems, the pain that you get from a calf problem, the pain you get from a bunion, the pain that you're getting that your doctor said is arthritis, and maybe or maybe not there's degenerative changes. If you'd like to attend, 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend this Wednesday's presentation on foot and ankle problems. You're going to find out there's a lot that you can do on your own to shift. There's some real easy exercises, some real easy take-home fix-it things that are possible, but more importantly, you don't have to suffer. Let's talk a little bit about, let's walk through a process, Doc, on what really happens with a problem such as a tendinitis, that inflammatory condition that affects the long tendon insertion into the heel, and then ultimately we end up with something called a plantar fasciitis.
Well, the first thing you got to consider is the bones in the feet. There's 26 of them. That makes up 31 joints, and there's 20 small, what we call intrinsic muscles in the foot itself, little tiny muscles that hold the foot in position. When we look at the foot, we consider the arch that we have, and there's actually a medial arch and a lateral arch, and then there's a transverse arch, which gives us a trussing effect and holds up the whole foot. So when those arches are maintained, then we can walk normally and we can run and we can stand. However, when those arches start to break down, either because the joints themselves don't move properly, or in many cases the joints move excessively, then we're going to start to see the signs and symptoms of an overuse type thing like a tendonitis, or a degenerative thing like an arthritis.
Does the arthritic condition, the presence of the arthritis in the foot, does that mean it always will show up as pain?
No, not at all. Usually it's dysfunction. So especially in the great toe, in the large toe, when we start to develop degeneration in the large toe and it can't bend upwards when we walk, then we change our mechanics of walking totally. The whole toe-off phase is predicated around the ability for the toe to come up, and it's called the windlass effect of Hicks. As that toe comes up, it stretches the plantar fascia on the top of our foot and maintains our arch. So when we can't bring that toe up, that mechanism doesn't take place, we become inefficient, and then everything falls apart from there.
703-698-7117, 703-698-7117. That's how you register for this Wednesday evening's presentation on foot and ankle pain. If you have any of these conditions, you think that your body's being destabilized, if you walk around and you need support in your feet, really, this is a presentation that I would highly encourage you to be present at, because you can fix this stuff. These aren't conditions that you need to live with. These are things that are fixable, that you can do right now and get back your life where you thought maybe you lost it. Based on something that you just said, Dr. Browning, question is simply this. If somebody has, and this is a simple one, somebody has flat feet, and, they walk around and there's no, they walk on a wet surface and they're walking, you see no impression of an arch whatsoever. Is that natural? Do people have naturally flat feet, or are they generally all acquired?
That's a great question. I would say in certain situations that it could be natural, and I wouldn't say in every situation that flat feet is bad. Obviously, if there's a symptom pattern, you want to consider it. Some of the most flat feet I've ever seen, and this is kind of by default, just looking at a person who comes in the office, let's say they have a back complaint, the person has absolutely no foot, problems going on. So, I look at the flat feet as being problematic, but I don't think in every case it has to be symptomatic or be degenerative in nature.
I've had flat feet, and I asked you this as a setup question. I've had flat feet since I ever knew that there should be an arch in my foot. And I've played sports, and I've run, and so forth and so on. And the one time that somebody actually told me, this is before I got to do what I'm doing, that they tried to correct my feet when I was in college, set up some pain that I had never had in my life. And they were shifting my body mechanics, and in those days, I didn't have the traumas and the trials and tribulations that have taken place over a period of time. So I do know from my own experience that if you shift my arch without the presence of a reason to do that, just to try to supposedly enhance my performance, that it breaks me down. So subsequently, as you said, it can be that flat feet are totally normal in the presence or in the absence, if you will, of any symptomatic presentation, either dysfunction or pain.
Yeah, and outside of the mechanical reasons that you'd want to elevate the arch or maintain the arch, you have to remember there's an overlying neurological process going on that we call the positive support reaction. And that's why all these companies like Nike, Adidas, Reebok are coming out with these minimalist shoes and these five-toed shoes, because they're trying to take advantage of the way the neurology is set up. Now, having said that, the problem is if I'm 45 years old and I've worn shoes from day one, because that's what we do in this culture. So if you're going to assume that all of a sudden I can go from wearing shoes for 45 years and have adapted to it to being barefoot, you're going to run into a lot of problems, and you're seeing that now when people are just totally throwing their shoes out and they're running with these five-toed Vibram sole.
So your family was just more sophisticated than mine, because when I started out in this life, coming from a peasant family, I walked around barefooted all the time, and no, it was my choice.
So you could probably get away with wearing these new shoes.
I'd love to try them. I see. Matter of fact, Dr. Poe wears them periodically in the office. And the first time he came in, he had slacks on and so forth. I said, "What are you doing?" he said, trust me, these are good. I said, what are you doing? They don't look good in the office. And we went back and forth, but he wore them, and they're really great shoes. Coming up to a break, we're talking about foot and ankle pain, and Dr. Harlan Browning is my guest. He's going to be your host this Wednesday, the 12th of the month, 7:30 p.m. at the Roselle Center for Healing. If you'd like to join us and find out if something can be done about your foot pain, 703-698-7117. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about foot and ankle pain. My guest, your host this Wednesday night in studio right now, Dr. Harlan Browning. We're talking about all those things that can make your feet hurt, but more importantly, all those things that can happen to your feet that can make other parts of your body hurt as well. We'll talk about whatever you like to talk about. If you have problems with bunions or sprained feet or ankles that, swelling that just never seems to go away, arthritic conditions, the old tendonitis, plantar fasciitis, this is the beginning of things that can happen to your feet, and you really need to know that you don't have to suffer with these things forever if you learn how to take care of the problem. A lot of these are vascular involvements as well, blood supply issues, but more importantly, the fix is really straight up, providing that you take the time to find out what it is. I want to remind a lot of you, many of you did see the Ageless Health presentation, the documentary that WIDA PBS did on our work, and it was over the top. And I'd like just to take an opportunity to thank all of you who've had so many kind words, literally hundreds of you, that have apparently seen it, but make sure that you also donate to WIDA, to PBS, because that's what will keep this program going. Dr. Browning was on, and he was amazing, and also the consummate teacher, as he always is, and came across very, very well on the presentation. But you'll have another opportunity if you didn't have the chance to see it. Go to WIDA.com or WIDAchannel26.com and look for their schedule, and just click on Ageless Health. It's going to air several more times. January 1, it will definitely air. I don't know what the other dates are this month, but it's already been aired 2 or 3 times. But take the opportunity and let us know what you think. We were delighted. We were happy. It will give you the chance to see what really can be done from structural, chemical, emotional vantage points when everything is done at one time and getting rid of some awful problems that people suffer from. Ageless Health. In addition, talking about Ageless Health, my book, Ageless Health, Health is a Do-It-Yourself Program. What a great Christmas present. If you'd like to give somebody an opportunity to really turn their life around, go online, go to drtomroselle.com and buy it from our store, or go to amazon.com. You can buy it off Amazon. But this is a gift that if you really want somebody to get it, this gives you the step-by-step of how to begin the process of changing structural, chemical, and emotional. Ageless Health. Health is a Do-It-Yourself program. Dr. Browning, let's talk about what we're talking about, but more importantly, we have some callers, and I don't want to ignore them. Let's get to them out of respect. Mike, how can we help you, sir?
Oh, hi there. I had a triple arthrodesis performed on my left, I believe that's how you pronounce it, done on my left ankle where they put some staples in to fuse the bones together.
What happened?
And,
why? What was the reason?
I had a really bad injury in football. I had flat feet, and I played football, and I injured my ankle terribly, and the pain was unbearable where I couldn't even walk.
How long ago, Mike?
1977.
Okay.
So it's worked out really well. Occasionally with weather such as what we're experiencing today, I'll get a little twinge or something. I've never had the staples removed because, frankly, I'm a wimp, and
got it.
It hurt going in. I figured it would hurt coming out.
It does.
I'm just wondering, I was told that one day I'd need possibly a new ankle put in, and I'm trying to avoid that at all costs.
Let's talk about that a little bit.
Mike, how old are you?
Oh, I'm 56. And
you're in pain on a daily basis, or just with certain activity?
I'm no longer in pain. I feel great. It's just, they told me that one day this is going to break down probably, and I'd need a replacement ankle.
Well, as with most replacements, the good surgeons will tell you that you start to consider about replacing something when either there's irretractable pain, in other words, it's hurting all the time, or it's just greatly changing your quality of life. So the interesting thing about the ankle is it has so much mobility in it. that we can often compensate when there's dysfunction in one part of the foot by picking up the slack somewhere else. So my recommendation is if you have still good function and you're certainly not in pain, then I would do the things that you need to do to keep the ankle happy and healthy, which would be proper fitting shoes, supporting the arch, rehabilitation, and specifically working on your proprioception or your balance on that side.
Mike, let me add a little bit to that as well. Arthritis comes about in degenerative changes in any joint space, no matter what it is, as a result of, in this case, trauma superimposed upon an underlying inflammatory condition. So what you can do to make sure that you modify that as much as possible is eating well, making sure that you get all the garbage out of your system, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, and as Dr. Browning said, keep it very, very well supported, and then you shouldn't have the need to have it replaced. Stay in shape, keep the muscles around it strong, and even the minor pain that you have right now when the weather changes can be handled by acupuncture. Mike, I'm sorry, wish we could go further. Thank you for the call. We're coming up to the news, and we have to take a break for some very important information and our sponsors. We'll be right back. You're listening to Dr. Tom Roselle Live. Welcome back. Dr. Tom Roselle here. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We have a topic, but we'll talk about yours as well. Talking about foot and ankle problems. All kinds of problems, from bunions to sprains, arthritis, tendonitis, plantar fasciitis, and even vascular problems, which we're going to tweak about a little bit here. But nevertheless, all of these things generally are very easily resolvable. The problem is that lifestyles get in the way sometimes. Our pride gets in the way sometimes because of the shoes that we wear and the malfitting this and the way we sit and the exercise we don't get. And it goes on and on and on. However, there's a fix. This Wednesday evening, December the 12th, 7:30 p.m., we're presenting foot and ankle problems. All these things and many more. Your host, my guest in studio, Dr. Harlan Browning, is going to be talking about these things because this is his thing.
You know, Dr. Roselle, let me add something to this. We're really talking a lot about pain in the foot and the ankle, but I want to say that this presentation is going to be just as much about people who have ankle pain that eventually leads to knee pain, that leads to hip pain, to low back pain. So this is just as much about people who have stuff going on in their knee, but they don't know why it's there. No injury, nothing to explain it. But what happens is the foot flattens, then the tibia, the bone in your lower part of your leg, rotates in, and that ultimately impacts your knee and then your hip. So this is about everything from the foot up to,
we see a lot of medial compartment tears as a result of that.
Yeah, certainly. The meniscus slowly gets worn down because of that.
It's unfortunate that traditional physicians don't look at the paradigm. They look at the compartment. They look at the symptom process. Well, if it's the knee, then we got to fix the knee. But even more so in the things that we do generally. We talked about all the acupuncture meridians going to the feet, and we talked about some of them going away from the feet, and we talked about the different muscles. Every muscle has a function neurologically. Every muscle has a balancing act with other systems within the body, and you have to look beyond those things. There's an interesting point in the bottom of the foot. It's called kidney 1. It's a source point. It's a major energy input point to so much in the body. But the interesting thing about this point is that in any foot problem worth its salt, if you deal with this point, if you support this point, if you stimulate this point, and in traditional Chinese medicine, if you take a needle and needle this point, most foot problems are modified dramatically. It's always served to blow my mind. I've never seen a foot problem that hasn't had some input to this.
And you could take it one step further. In applied kinesiology, that obviously the technique that we really specialize in, we know that there's a muscle-organ relationship. So one of the muscles that I almost always find that's involved with knee problems is a small muscle behind the knee called the popliteus. Its responsibility is to unlock the knee when we're moving. It has a relationship to the gallbladder. So it's nowhere near the gallbladder, but it has a relationship. So one of the things that you often find is that the person has maybe poor digestion, and that poor digestion is being reflected by weakness or maybe spasticity in this muscle, and ultimately they have this knee problem. So when you tell them that their knee problem has more to do with their gallbladder than it does their knee, it blows them away. However, when you change the diet or maybe give them some bile salts or a digestive aid, and lo and behold, 3 or 4 days later, that knee that's been bothering them on and off for a year is feels great, then they say, this is amazing.
And here's the extension of that. We're talking about the connection between ankles and knees and so forth, and feet and ankles, and so that muscle also has that related acupuncture channel, which ends, by the way, on the foot. So here's that relationship we talked about again, the foot and the knee, the muscle behind the knee, and it goes on. We have in the foot, we have bladder function muscles as well. And a lot of women who come in who have urinary incontinence and bladder problems, often it's their foot that initially, particularly when they're younger, and they're saying that they can't control. You fix these muscles, you support them the way they're supposed to, you handle the connection, and that symptomatic presentation is no longer there. 888-630-9625. We'll go to the phone. Matt, thank you for being patient and holding. How can we help you, sir?
Hey, thank you, doctor. I'll try to make this as quick as I can. In September, I took first of all, I'm a 53-year-old male, healthy, non-smoker, good diet, watch what I do, and retired military officer. Been on my feet a lot, my life. And in September, I took in fact, 3 months ago today, I took a fall about 15 feet working at my house and fractured both the tibia and fib, 3 places. Got put together with a plate and a bunch of screws back in my right ankle. I've been walking on it now for about 2.5 weeks and getting most of my flexibility back from physical therapy. Here's what I've noticed, though. I have heel pain now in both heels when I walk. I had none in my left before, no problem at all. I'm having it now, and I'm just curious, is that maybe just a possibility of a result of not even walking on it, not weight-bearing very much, and using a crutch for 2 months, and just need to toughen back up, or what?
Matt, I would suspect that has a little bit to do with what's developing after the injury. In other words, when we fracture that distal part of that tibia and fibula, that's called the ankle mortise, it's going to prevent our foot from dorsiflexing or coming up. When we can't dorsiflex fully, we call that an equinus position, which by default makes us walk differently. Either we need to, one, pick up the foot earlier in the heel, or walk on our toe to make it happen. So either or, it's going to change the way you walk, so you're going to probably be putting more pressure on the other foot to compensate, and certainly changing the way you walk on that foot, so you can certainly have something going on the opposite side.
Matt, the other situation that is possible in this type of thing, with any type of trauma, you can end up with a muscle reactive pattern, where you have the antagonists and protagonists of the muscles, the opposing muscles, not working in sync like they're supposed to. So until the one muscle is brought back to normalization and stabilized, then you're going to have that abnormal pull on the joint space, also causing that type of problem. But you have to go from the foot all the way up as well. You've got to check the foot, the ankle, the hip, the low back, because all that neurological network is involved here, and unless it's balanced properly, you got a problem.
Well, I'm finding symptoms actually going to my knees and my back now, but it didn't have before. So that makes perfect sense.
Yeah, well, you have total destabilization, and it can be resolved. Unfortunately or fortunately, we do see a lot of these conditions, and because we see a lot of athletes and traumatic endpoints of the things that they do, a lot of professional guys in the Washington area. So when you have a post-surgical thing with all of, the trauma took place, then the surgery's a trauma, and then so you have all of that you have to take into consideration. So you have to look at muscle strength, you have to look at positioning below and above where the problem is. And then, based on that, treatment can be very, very specific, and you can usually make huge changes. Matt, come on down to the presentation Wednesday night. Talk to Dr. Browning straight up, and he might be able to give you a few insights.
Yeah, I'm trying to clear my schedule for that.
Love to see you. Thanks, Matt. Appreciate it. Thanks for your phone call. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're talking about foot and ankle problems. Dr. Browning will be your host this Wednesday evening, the 12th, 7:30 p.m. at the Roselle Center for Healing. That's the topic. That's our in-house continuing education program. We do these as a public service. It's something that we feel is necessary to help you get a better understanding of what can be done, to take you outside the compartmentalization, if you will, of traditional approaches, and realize that where it is ain't necessarily where it's coming from, so to speak. So, Dr. Browning, let's talk a little bit about a very, very interesting and very, unfortunately, painful presentation called bunions. These people, many people are going to their podiatrist and they're having surgeries to straighten their toes out and doing all kinds of things. Why do we get bunions? And sometimes why one foot and not the other?
Well, a bunion is basically special way to say degenerative change or arthritis, more specifically in the big toe, but you can get it on other toes also. It usually happens because either I'm going to go back to what I said before. The shoe doesn't fit properly in women, so they're in a high heel, so they're forcing that large toe inwards, what's called a valgus deformity. And as we force that toe in, then the joint space is going to be compromised, and it's going to start to break down on the inside. And on the outside of it, we're going to see new bone growth to help support that new position. The end product is it's very, very painful, and it changes the way we walk because it limits the ability for the large toe to move upwards and downwards.
You get somebody that comes in with that, and you can do a lot of mobilization, you can do a lot of strengthening. The advent of kinesiotaping also helps. The muscles of the medial arch of the foot are critical. That's often where we see them break down, presenting a hammertoe, if you will, or a bunion type of condition. And, the thing that is also, and we go back to the relationship between muscles and acupuncture systems and so forth, on the big toe, there's two acupuncture meridians that start there. One is the spleen meridian, which has to do with many different things, muscles and ligaments, but also has to do with pancreatic function and immune function. But it also, or in addition to that, is the liver meridian on the other side of the big toe. Both of them start at that place. So often when we don't have energetic motion or movement in those areas, we can begin to get debilitation and breakdown in that area. And what I see often is that relationship, and I know you do as well, and it's just we're talking about mechanics right now, we're talking about orthopedics right now, but we still have to look at all those other pieces to be able to fix something.
Yeah, we certainly do. Coming out of the gate when you work with a patient, I think it's best to maybe present things from a structural standpoint because it's easy to understand. You can diagram it. We have foot models in the office, but in reality, many times these people are suffering, not so much because it's a structural integrity problem, but more because it's the physiology or, as you put, the energetics of the body failing.
I don't think there's a case, but particularly when it comes to the feet, for me anyway, when I'm looking at these problems that come into the office, that if you fail to really understand the neuromechanics, the pedal-based mechanics of the foot and how it works and the acceleration-deceleration mechanism and its relationship to everything else in the body, you failed the patient. You can't take them in place of not only get rid of the pain, but also returning function.
Right, and really the foot is about returning energy, as you put. So if the foot becomes faulty, then we don't transmit energy all the way up our spine, really up to our shoulders. We had the opportunity to sit in on a conference about, I don't know, it's probably 5 or 6 years ago where Dr. Myers was there, who's very famous about anatomy training. Right. And it was just fantastic because basically what he did over that 3-day seminar is just trace how the muscles of the foot basically are contiguous or continuous with the rest of the body. So a dysfunction in the foot, he could show us anatomically could cause a breakdown in the movement of our shoulder on the opposite side.
The foot has so many proprioceptive mechanisms and so many neurological and reflexive mechanisms. There's a whole field of foot reflexology, which we incorporate into what we do. But there are triggering mechanisms for the entire body. So subsequently, if you can trigger from the foot an action or a diminution of pain someplace else in the body, then it would just kind of be an easy draw to realize that something in those other areas distally from the foot could be causing problems in the foot as well.
Yeah, and you see this almost always with people who have pain that they don't know where it came from and it's not going away.
And that's the biggest thing. Patients come in, if they go to a traditional physician, in whatever pain pattern that they happen to have, and the doc says, well, let me give you this steroid, let me give you this medication. In most people's minds, it's almost like the pain pill, the arthritic pill, the anti-inflammatory has a brain, and it only goes to that place. It goes to that one little place. And the truth of it is, it affects the entire body. That's why we have the side effects of all these medications. And with the anti-inflammatories, the Celebrexes, the corticosteroids and so forth, the degradation, the breakdown in the body sometimes far supersedes the problem that's being treated.
Yes, certainly. It makes us feel better temporarily, but unfortunately it speeds up the process of what's taking place to begin with.
This Wednesday evening, December the 12th. December the 12th, 7:30 p.m. Dr. Harlan Browning will be your host at the Roselle Center for Healing. He will be talking about foot, ankle problems, and all those things we're talking about today, but more importantly, how to fix them. How do you change these things? How do you get rid of them? How do you get function back? How do you really get back to a place where you can mechanically and physiologically act normal again? Just give us a call, 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend, and I promise you, if you haven't heard Dr. Browning present before, it is a treat. It's a pleasure. This guy is a consummate teacher. He gets into the intricacies of it. He shows you how to fix something, but more importantly, it can be done quickly and very straight up. Most of the problems that you're having are easy fixes. They're not something that you have to deal with. Go to our website at rosellecare.com. That's ROSELLECARE.com. Go into our business section, take a look at our store, see what's there. We have a lot of wonderful things for you, but more importantly, you can also pick up our book, Ageless Health. Health is a do-it-yourself program. Great Christmas gift. Absolutely fantastic. It's in its second edition. It's been a phenomenal gift for so many patients being able to help themselves. Got to take a break. You're listening to Dr. Tom Roselle Live. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, as you do every Sunday at 12 noon. We're here bringing you the most up-to-date information of things that you can do for your health, to make it better, to get out of the pain, to explore your wellness potential without drugs and without surgery. This is why we do what we do and why we've been doing it for so many years. You can always get a hold of us at 888-630-9625 when we're on the air. And when we're not here, if you can get us offline, if so to speak, you can go to rosellecare.com. That's ROSELLECARE.com. And send us a note. One of our docs will get back to you. And also go to drtomroselle.com. Either way, you will hear from us, and we will answer your questions as specifically and directly as we possibly can. But more importantly, if we can help you in any way, and you'd like to attend this Wednesday's presentation, December the 12th, that Dr. Browning is going to be doing on foot and ankle pain, call us, 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. Dr. Browning, let's wrap this up a little bit. Let's talk about what it is you're actually going to teach this weekend, or this week, Wednesday, and why people should come and listen to you.
Well, if you've ever been to one of my presentations, you know we're going to go over a lot of anatomy and neurology. Not super in-depth, but, the basics, because I think if you understand the way things are laid out and the way we're designed to move and such, it makes it easier for you to understand why you're sitting in that seminar, why you have that problem. We'll look at some of the most common foot conditions, and we'll talk about why they start and what we need to do to stop them. We'll talk about some new technology we use in the office, this foot scan, this great piece of equipment that really looks at how the foot transfers weight when we walk. And we'll talk about conservative measures to fix the problems that brought them in there to see the presentation.
So regardless of what the problem is, whether it's a golfer who knows that their pedal base isn't doing what it's supposed to be, or somebody's playing tennis and they're noticing that they're having an issue that they didn't have before, it's all these things can be strictly foot pedal-based problems, particularly when they're asymptomatic, but when they are symptomatic and they're causing the plantar fasciitis conditions, which is really very easy to take care of from our perspective. It's not one of those things that you have to suffer with for months and months and months without any resolution. You can turn it around. We're going to go over those things intimately, and you'll have the opportunity also to answer questions, correct?
Yeah, I really enjoy doing the question and answer stuff. Sometimes we can get off on a tangent and go for long periods of time, but for the most part, I try to answer as many of those questions as I can, because if a person has something that's bothering them and they don't know why, I think they need to understand it and be able to figure out that there's things that they can do about it.
This Wednesday evening, 703-698-7117. This is one of the most amazing presentations and amazing because of this, because we don't interconnect all the pieces of the puzzle. We don't put together the why behind things traditionally. And when you listen to any of our in-house programs, you get the connection. You understand how things relate one to the other, to the other, to the other, and why you can't just focus on where the pain is, that you have to focus on other things outside the pain area.
Right, and this is also the first time that we've ever done this.
That's right.
Because I came up to you, I was like, how come we're not doing anything about foot and ankle? And you're like, well, I don't know, why don't you do it? And
that's why you do it.
Yeah, so it's going to definitely be fun. And I really enjoyed doing this one because it gave me an opportunity to review stuff that I hadn't necessarily looked at in the last year or so, and it's some powerful information.
These are presentations that we put together because we want to give you an extended benefit. We want you to understand how things really work. We want to get you out of the headspace that if you don't have a symptom, that you don't have a problem. These problems that you have been coming about and building up for a long time, not something that happened yesterday or the day before. It's critical that you get that. When we did the Ageless Health documentary this last year, we were able to film it. It gave us the opportunity to sit back and take a look at all the people that have come in with different types of problems and conditions, and that nobody could help. And when we look at it, we say, man, this isn't a big deal. It is a big deal, but we look at it from a multidimensional presentation. This Wednesday evening, Dr. Harlan Browning will be your host, December the 12th, 7:30 p.m. If you have any kind of problem that you think might be related to your feet, you have somebody that's toeing in or a pigeon toe walk and you want to get rid of it, this is an opportunity. We're here every Sunday. We'll see you next week at 12 o'clock sharp, just as we do every Sunday. This is Dr. Tom Roselle. See you then. Bye.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.